The first question. So how did you, as a lawyer, find yourself involved in healthcare?
Well, growing up, my dad's a obstetrician, gynecologist. My mom's an ER nurse. I decided not to go to medical school before I put my applications in officially. So there was always that interest, even if I knew it wouldn't be my life's passion. I always definitely had an interest in medicine. And as I went on with my career, I thought about getting another degree and realized that I was more interested in the law, mostly for its versatility and what you can learn and the skills you pick up in law school and how you can apply them to various careers and goals. And so 3 years after college, I entered law school.
Okay, let's talk about the hospital, Augustine Memorial Hospital. What specialties will the hospital feature for its patients?
So it's been my father's dream to build this hospital for a very long time. We're naming it after his father, my grandfather, Augustine. So it'll be Augustine Memorial Hospital. And it will be a world-class tertiary hospital in its final stage. So whatever you can get at the best hospitals here in the States, be it cancer, radiology, dialysis, orthopedics, rehab, physical rehab, and rehabilitation and therapy. They'll all be available at our hospital. We're going to start the first stage with orthopedics. Women and children, maternal and infant mortality is a huge issue in Nigeria, and also HIV/AIDS and malaria, which are also still huge issues there. So that will be the focus of the first stage.
Here's a question for you. Do you think that the infrastructural obstacles, such as the unreliable electricity supply in Nigeria, will make it difficult to operate to full capacity?
Sorry, can you repeat that?
Do you think that the infrastructural obstacles, such as the unreliable electricity supply in Nigeria, will make it difficult to operate in the way that you want?
It'll certainly be a huge challenge, and it's something that we're confronting. We know we're going to have our own power supply, our own water supply, our own waste management, maybe even build our own roads leading into the hospital and the grounds. So we're factoring all of that into our planning and into our development of the hospital.
Okay.
And something that we know that we can't rely on the power grid and we can't rely on the water system. And so it's a challenge, but we definitely aren't going to let it stop us from doing what we need to do to making this hospital the best hospital in the region.
Okay. So where will the doctors that will come to work at Augustine Memorial Hospital come from?
It'll be a mix. We want to make sure that we build up local capacity, so as much as we can, we will take local Nigerian doctors and train them, hopefully in Nigeria, but definitely train them on, for bringing in an orthopedic surgeon, make sure he gets the best training, cardiologist, and we'll supplement those local doctors with doctors from here in the States. A lot of doctors, my dad's generation, those who are in their 60s, late 50s, 60s, are interested in going back. A lot of young doctors are really interested in going back. I talked to a lot of medical school students, a lot of interns and residents, and full-blown doctors who want to give back and use their medical skills to help improve life in Nigeria. So we will have a lot of doctors who are trained at amazing med schools and have gone through really great residency programs here in the States as part of our pool.
Okay.
And so we'll supplement local doctors with doctors here who know how to operate a world-class institution, who have experience running advanced medical systems, and then we'll train local doctors as much as we can.
Okay. So as for the doctors in the United States, they actually want to come back and make a living at your hospital.
Yes. Yeah, we have a lot of doctors who want to have careers. They were either born in Nigeria or spent a lot of time there, and they want to go back, but there's just no high-quality
That's very true.
There's definitely a hunger, and I anticipate we'll have our choice of doctors and nurses and administrators once the hospital is up and running.
Okay. Any comment on the state of healthcare, the healthcare system in general in Nigeria, and how it can be improved?
I think there's huge gaps, and I think I know the country cannot develop the way everyone wants it to, the way the government wants it to, the way the international community, and especially the way Nigerians want it to, without improving healthcare to drag on everything. And that involves spending more money on healthcare, both the government and the private sector, but also spending the money smarter and also building up infrastructure, fixing the power system and the water system and the roads are probably the best things, are some of the best, most impactful things the government can do. And people, I'm sure there are lots of entrepreneurs, either on the business side or nonprofit side, where we are, who want to get involved in the healthcare industry, who want to build hospitals and clinics and various centers or medical schools. But the cost of running generators, of powering these hospitals, of providing clean water, of dealing with bad roads, it makes things not worth it. It's too financially onerous. And so the government, by just doing its job and providing clean water and better roads and reliable power, can unlock a lot of opportunities for those who want to get involved in the sector. So too many people in Nigeria are dying needlessly, dying because of their poverty, dying because of lack of health care, dying because they can't afford to fly to the U.S. or the U.K. or India for treatment, and we all have to play a part in saving those lives.
Right, and that's actually my next question for you is what do you think about Nigerian politicians who do fly internationally to receive top-of-the-line health care?
Yeah, it's unfortunate. You have people who are in charge of the system, spending money on the system, who don't believe in it, and the very proof of their lack of belief is the fact that they don't use it, and that they don't think twice about flying to the UK for an eye exam or a screening or something. It's so the amount of money that the government is spending on these flights and this healthcare for government officials, politicians in these foreign countries is spending that money, devoting it to building up the local community, not only will keep them in the country and prevent, I'm sure whether you're a rich politician or a rich businessman, it's still a hassle flying halfway around the world for good health care. I'm sure they would prefer to get their health care needs taken care of in country.
Yeah,
the time and the money and the danger of flying. So they have to just realize that it benefits them as well as their families and their communities to build high quality hospitals and clinics in the country, and that they're also representatives, and that if their people can't fly out and get health care, it's not right that they can easily access it. And I can see why their constituents and the people who voted them in are angry, and they don't have this option that the government is spending their tax dollars and their money, their oil money, or the country's resources on their own private healthcare system outside the country when they're leaving the country, the 90%, 99% of the country to suffer with a terrible healthcare system.
Okay, so tell me, where is the hospital actually being built?
It's being built in Anambra State.
Okay.
It's where my father was born. Well, it was where he grew up, where his family's based. We have a great relationship with the local government, the state government, and it's made sense to build it there, given the local support that we have in that region, in that state.
Okay. So is it safe to say that your main clientele will, of course, they're going to come from within the state at first? Would that be an accurate statement to say?
Well, if you build a high-quality hospital in Nigeria, you're going to get people from all over. And we do medical missions. We have people coming from all over the country,
right,
even outside the country, people want to access good health care. Right. And if they're willing to fly to London or fly to New Delhi or fly to New York, they're going to want they can drive to Oka or fly there, fly to Enugu and drive down. So it's we got to draw from all over the country. When people hear the high quality, they're going to come in from everywhere. I don't think anyone's going to not want to take or make that trip because it's in the southeast. I think we're going to draw from everywhere, but it's, of course, from Monterey first and foremost.
Okay, so with that, are there any plans of building additional hospitals across Nigeria in different areas?
Yeah, our main mission is this hospital and making it the best and building it in stages, and that'll take several years. But as we develop, we want to impact healthcare in the country and in Africa. And so when we establish this model and we get it to the place where we feel comfortable with the operations there, wherever we're welcomed and wherever we get the support from the local community and the government and we get what we need, and then also we have resources, we will look to build and expand. Certainly, we don't want to stop at one hospital. Country and the region needs more than one center of excellence. So as we're able financially and in terms of our own internal infrastructure, our own capacity, if we're able to build additional hospitals, we'll certainly look to do that.
Okay. And how have you been able to fund this project?
So majority individuals, family foundations, corporations who have donated.
Okay, so just through donations. Okay, and I've heard that you've had some celebrity donation into your project. Could you give me an idea about who exactly has donated?
Well, we've gotten some celebrities to appear at events and lend their support that way. Forrest Whitaker, the Oscar-winning actor, appeared and keynoted our 2009 symposium on women and children and why so many mothers and young babies die in Africa. And he did that at the California Institute of Technology, and he has since been a supporter of our work. We've had the Oscar-nominated actor, multiple Oscar-nominated actor, Jaimin Hansu and Kimberly Simmons come to an event in April of last year. And so we're happy to have their support. Jimmy Kimmel, the late night television host, he's donated. We've been happy to have his support. Chinua Achebe is our honorary chairman. He's probably the most well-known, if not African, and Nigerian, next to Nelson Mandela, Desmond Tutu. He's just, well regarded for his literature and his work. And so we're happy to have his support. And we're continuing to grow it. Moby Okoye, who plays for the Chicago Bears in the 2011 season, played for the Texans before then in Houston. He's been a supporter of ours. The governor of Illinois, Congressman Jesse Jackson Jr., his father, the famous Reverend Jesse Jackson, is a supporter of ours. So we've definitely been very blessed to have these individuals and companies as well support us, and we just need to constantly build upon that and continue to spread the word and get as many people as possible behind this, which is our main mission is to grow the GEANCO family, whether it's celebrities or just doctors or lawyers, bankers, anyone can support this mission and use their talents and their networks and their resources to help us save lives.
Okay, that's very, very good. I just want to say that, once again, I think what you're doing is amazing, and I just want to wish you the best of luck. Yeah.
I really appreciate it.
Yeah.
Thank you for reaching out and allowing me to talk about what we're doing and keep up your own good work, spreading the word about all the positive things that hopefully people are trying to do besides us, trying to help out back in the homeland.
All right. Well, take care, and we'll talk another time, okay?
All right, take care.